Okay, so my name is Dr. Brian Regis. I'm a chiropractor with Performance Chiropractic, and today we're going to talk about low back pain and sciatica, particularly sciatica, and where it comes from. There's typically two main reasons why people are going to get sciatica. One is there's a herniated disc, and the second reason is there's some type of muscle tension that is now impinging on the nerve. The muscle impingement is very common. We see it routinely. Can there be a herniated disc? Absolutely. There's easy ways to check for it. We're going to talk about what to look for if you're experiencing any low back pain or sciatica. So first thing I want to talk about is, what is sciatica? Basically, you have what's called a sciatic nerve that goes down the leg, and it's a series of smaller nerves that come from the low back, and they bundle together to go down the low back. And they go to different areas of the leg and can go all the way down to the feet. Someone who has a herniated disc, where that disc is protruding and laying on the nerve, typically are going to have some symptoms down the leg. It could be numbness, it could be tingling, it can be more of a burning, achy pain, but those symptoms are almost going to be constant because that disc is laying on the nerve and it doesn't go away. So for those people, I look for either it's bad or it's worse. They may say, I always have sciatica, sometimes it gets worse, but it never fully goes away. The other thing I look for is if there are periods where it does go away completely, maybe there's sciatica down the leg, maybe to the knee or to the foot, and then it goes away completely, those people usually do not have a herniated disc that's causing the issue. So if a patient comes in, constant numbness, tingling, we might do 2 or 3 treatments to see if they make any type of a response to care. If they don't, we're typically going to refer them out for an MRI. That usually confirms that there's a disc herniation, and those people are going to move on for surgery or some type of injection, something more invasive. For people who are not quite that severe but experiencing severe pain, this on and off numbness and tingling down the legs, those are usually prime candidates for sciatica. And here's where that comes from. You have your 2 pelvic bones here, and around those pelvic bones are a series of muscles that stabilize the pelvis. Well, what we see a lot of times, and this is common with people who are fairly active, work out, they'll notice that their symptoms either get worse during activity or afterwards. These 2 pelvic bones can rock back and forth, and what's happened is they've rocked, twisted, and become unlevel. So now, in a sense, that person is crooked. That crookedness causes muscles around the butt cheek area to spasm and can impinge on that nerve. So basically, I'm going to take you through the same 3 steps that I show patients when they come in and we do our report of findings after their initial exam. So first we have the skeletal system, and what we look for in an exam is the pelvis level? If it's not level, there's some type of twisting and contorting, then I'm going to put pressure on the 2 joints in the pelvis, and usually one or both of those are tender. So that's going to be the first thing we look at. Then we're going to move to the muscular component, and there are a series of deeper muscles, glute muscles, that help stabilize the pelvis, but when those pelvic bones shift and twist, you get an uneven amount of tension between the 2 sides, and it creates basically a tug of war. That tug of war can progress, the muscles begin to swell, and as they swell, they begin to then pinch on that sciatic nerve, and that's where the muscles will swell, the symptoms kick in. When that swelling goes down, the person rests, they go away, the sciatic nerve goes away too. And that's where that patient will describe it coming and going. They usually know what brings it on, but they can't figure out why. This muscular component is the reason why. Underneath this group of muscles is this tree that we talked about, this tree of nerves, and they go down the leg. Depending on where that nerve is being pinched and how bad is going to determine their symptoms. So as a chiropractor, our job is fundamentally to re-level out the pelvis, get these joints moving and working again, let the muscles rebalance and heal themselves up, and then that nerve pinching goes away. So it's usually a 3-step process. Most soft tissue injuries take anywhere between 4, 6, maybe 8 weeks to heal, depending on how bad it is. Most people that we treat within about 3 weeks are back to working out, maybe 50% of what they used to, but they're back to working out and getting themselves healed up again, almost like rehab. So I hope that helps to explain it. If you have any questions, please give us a call, 440-572-2225. Thanks.